Assalamu alaikum. Today's article is titled Association between Apical Periodontitis and the Severity of Marginal Periodontitis in Root Canal Treated Teeth. It's a retrospective cohort study done by a Spanish group and published in Journal of Endodontics recently in 2026. So the purpose of the present study was to evaluate whether the severity of marginal periodontitis measured by the amount of bone loss is correlated with the development of apical periodontitis in root canal treated teeth. Additionally, a secondary aim was to investigate the variable associated with the development of apical periodontitis in patients with different level of bone loss. The present study is a longitudinal observational retrospective cohort analysis of patients with root canal filled teeth who attended the University Dental Clinic from January 2007 to December 2015. The inclusion criteria were patients aged 18 years or older who presented with at least 2 PA radiographs of the same root canal treated teeth with a difference of at least 2 years and who had not received periodontal surgical treatment. And also other inclusion criteria were root canal treated teeth with no PA lesion in the initial periapical radiographic examination, and also teeth with radiographically adequate root canal treatment, and finally teeth with an acceptable coronal restoration. The total estimated sample size was 1,725 teeth, 688 from healthy patients, and 1,037 from patients with periodontal disease. The patients were selected from the university database based on a consecutive list. Initially, patients were categorized into two general cohorts, those with normal periodontal bone loss and those subjects from this group were diagnosed as periodontally healthy and did not undergo any periodontal treatment, and those with mild, moderate, or severe periodontal bone loss. And for the periodontal bone loss group, patients were selected from a consecutive referral list of patients diagnosed of periodontal disease and treated non-surgically by students in master degree. As for the baseline radiographic apical periodontitis evaluation, two independent calibrated dentists, each holding a master degree in endodontics and 5 years of experience, evaluated the baseline periapical radiographs for the presence or absence of apical periodontitis, the quality of root canal treatment, and the condition of coronal restoration. And in case of disagreement, a third evaluator was consulted to reach a consensus. And for the evaluation of radiographic periodontal bone loss evaluation, two independent calibrated dentists with a master degree in periodontology, each with a minimum of 4 years of experience, scored the baseline periapical radiographs. The teeth were divided into 4 subgroups based on periodontal status as measured by their periodontal bone loss, either normal, which was BBL1, or mild, BBL2, which was less than 25% bone loss, moderate, BBL3, which was 25 to 50% bone loss, and severe, which was BBL4, which was more than 50% bone loss. And for the follow-up radiographic periodontal bone loss evaluation, the same two baseline calibrated periodontists assessed the BBL on the follow-up radiographs. And for the apical periodontitis evaluation, the same two calibrated endodontists who scored the baseline periapical radiographs evaluated the follow-up periapical radiographs for the presence or absence of apical periodontitis. The final sample comprised 1,011 root canal filled teeth, categorized into 4 different groups based on the periodontal bone loss status as follows: normal PBL group, which comprised 401 teeth; mild periodontal bone loss group, 304 teeth; moderate periodontal bone loss group, 228 teeth; and severe periodontal bone loss group, 78 teeth. The inter-examiner agreement of radiographic evaluation was rated as good to very good for periodontal bone loss scoring, and the evaluation of apical periodontitis showed a very good agreement, and the overall intra-examiner reliability demonstrated good to very good agreement for all evaluated variables. So among the 1,011 evaluated teeth, 102 developed apical periodontitis, 17 teeth in the normal periodontal bone loss group, 5 teeth in the mild periodontal bone loss group, 45 teeth in the moderate periodontal bone loss group, and 35 teeth in the severe periodontal bone loss group. The univariable mixed effect regression analysis found no significant difference in the odds of apical periodontitis development between teeth with normal and mild PBL, In contrast, teeth with moderate or severe periodontal bone loss had significantly higher odds of developing apical periodontitis compared to those with normal periodontal bone loss. And after accounting for potential confounders, the multivariable mixed effects logistic regression indicated that both smoking and periodontal bone loss were significant independent predictors of apical periodontitis development. The general model revealed no significant difference in apical periodontitis risk between normal and mild periodontal bone loss. However, moderate periodontal bone loss increased the odds of developing apical periodontitis by 8.4 times, and severe periodontal bone loss increased the odds of by 41 times, and both relative to teeth with normal periodontal bone loss. And smoking was also linked to a more than twofold increase in apical periodontitis risk. And when the regression model was adjusted for both smoking and periodontal bone loss, their association with apical periodontitis remained statistically significant, reinforcing the independence of these risk factors from other covariates. So, to conclude the findings of the present study, within the limitation of this study, a clear association was found between the severity of marginal periodontitis measured by the amount of bone loss and the development of apical periodontitis. And in addition to that, smoking habit also showed significant association with the development of apical periodontitis in endodontically treated teeth, acting as a confounding factor.